Good morning, everyone. Welcome and thank you for joining us today. Bonjour, nous vous souhaitons tous la bienvenue. La séance aujourd'hui aura lieu en anglais. Cependant, nous offrons une traduction simultanée en français. Pour l'accéder, vous n'avez qu'à sélectionner le canal français. My name is Tracy Lavin. I'm an analyst with the Secretariat that supports the Indigenous Child and Family Services Directors. I'm joining you today from the beautiful and rainy territory of the Squamish, Musqueam, and Tsleil-Waututh peoples. I'll introduce our panelists in just a minute, but first, Michelle Morningstar Doherty will open us up in a good way. Michelle is from our very own Secretariat. She joined us after a long career in the business world, and we're very lucky to have her. She's the glue that holds the Secretariat together. She organizes all the logistics for everything we do, including all the technology. She sends out all the emails. Probably every single one of you has had an email from her, and she answers everyone's questions and does it with so much loving kindness that we all end up feeling very well taken care of. Michelle, I'll hand it over to you to open us up.
My goodness, thank you so much, Tracy. I don't quite know what to say here, but I want to really just say to each and every one of you, thank you, thank you, thank you for being here. Thank you so much for being part of this wonderful time in our lives and for our children. And as we say, we are the ones we have been waiting for. Please send your kindness, your love, your strength to our three wonderful speakers today. Dr. Cindy Blackstock, who I'm sure everyone knows, Mary Teegee, the chair of our organization, and Helaina Gaspard, from Dr. Helaina Gaspard, I'm so sorry, from the Institute for Financial, sorry, I'm gonna just say my prayer, here we go. Just a little bit about me. I am here in the beautiful territory of the Tsleil-Waututh people. I hold them in such high regard, and the Squamish and the Musqueam, everyone here. I am a member of Cowessess First Nation, and a very proud one. And I am just honored to be doing this work with all of you. I'd really like to just say a couple of things here, just to read to you the words of Chief Dan George. As you know, he was an actor, a writer, a storyteller, and of course, the chief of our dear Tsleil-Waututh Nation. Here's one of his sayings: "The only thing necessary for tranquility in the world is that every child grows up happy." And this is for all of you. May the stars carry your sadness away. May the flowers fill your heart with beauty. May hope forever wipe away your tears. And above all, may silence make you strong. Both from Chief Dan George, hi, Chika, all my relations. Thank you.
Thank you, Michelle. I'll introduce now our expert panel. We have Dr. Cindy Blackstock. She's the Executive Director of the First Nations Child and Family Caring Society of Canada. She's also a professor for the School of Social Work at McGill University and the driving force behind the Canadian human rights complaint that ultimately led to the agreements in principle that we'll be hearing about today. We also have Mary Teegee. She's the chair of the Indigenous Child and Family Services Directors. She's also the executive director of Child and Family Services at Carrier-Sakani Family Services and the BC representative to the National Advisory Committee on Indigenous Child Welfare. And Dr. Helaina Gaspard is the director of governance and institutions at the Institute of Fiscal Studies and Democracy at the University of Ottawa, and has been leading the development of the funding structure, the measures to thrive that form the basis for much of the AIP on long-term reform. Welcome, Cindy, Mary, and Helaina. Thank you for taking the time again to provide more information on the agreements in principle. We're going to start with a brief overview of the two agreements in principle, and then go right into the question and answer session. We do have a long list of questions that were submitted ahead of time, and we'll try to get through as many of those questions as possible. Oh, and just one more thing before we get started. This session is being recorded and it will be available on our YouTube channel. And Michelle will send out a link to the recording in our newsletter, which you will all receive. I'll turn it over now to the panel and to Cindy, I think, to give us some background on how we got here.
So a very good afternoon or good morning to everyone. I'm really honored to be here, and I join you from unsurrendered and unceded Algonquin territory, where it's finally peaceful, and you'll be happy to know there was the Algonquin nations had a cleansing ceremony here, so the environment is feeling much better. So I just want to acknowledge all of that, and all of you who have joined on the call. So how we got here was really collectively over many decades. And I know that this starts on February 23rd, 2007, but I really want to recognize everyone who came before that, who called attention to the dramatic inequalities in services that First Nations children, youth, and families were receiving. That record goes back as early as 1907 and even before that. But in February 23rd, 2007, what changed is that we lost our patience for waiting around for the government to implement the solutions we had jointly developed. And we lost our patience because the result of that inequity was more First Nations children being separated from their families than at the height of residential schools. And that's despite with us having, First Nations agencies doing everything in their power that they could to try and keep families together, but they just didn't have the resources to do it. So we filed that human rights complaint. And it's important to know that although we have a very kind of quick advance to 2016, Canada fought that case tooth and nail on jurisdictional grounds. Some people think this was only a case about the tribunal, but it wasn't. It went to the federal court on 8 different occasions. It went to the Federal Court of Appeal. And it was only after we were able to defeat Canada on its jurisdictional challenges that we got to the most important matter, and that was the evidence on the merits. And I saw quickly some of our witnesses are on this call today, people like Raymond Shingoose and others who testified, and we filed all those documents. So that led to the decision in 2016 that Canada was racially discriminating against these children, and it was ordered to stop. That's very important. This is a legal order. And Canada came out and paraded ministers, but it didn't do it. And so we've had to go back. And we've now had, I think it is 21 non-compliance and procedure orders against the Canadian government. Even though we were making progress with those non-compliance orders, we hadn't really got Canada even to a place where they would publicly admit that the discrimination was ongoing. That change was only made possible by the spirits of the children in the unmarked graves. When that came forward, when these little children's voices and spirits came to more public consciousness, the public pressure on the government to move, along with their losing legal record, created the scenario where the federal government wanted to negotiate a settlement. And that's what led to these agreements in principle. These agreements in principle are non-binding in nature. There are 2 of them. The Caring Society is only a party to one, and that's the one on long-term reform for Child and Family Services, for Jordan's Principle, and for fixing the department. There is another one on compensation that builds on the Canadian Human Rights Tribunal's decision on compensation, but it'll go further than that. It'll go back till 1991, whereas the tribunal only went back to 2006, and it'll include some other groups that the tribunal didn't contemplate. So that agreement in principle is separate from what we're going to be spending most of our time talking about today. I think we're ready for the next slide, Tracy. And I think I'm going to pass it to Helaina.
Thank you very much, Cindy. Always an honor to be joining you. I'm joining you from the traditional territories of the Algonquin people here in Ottawa. So on the reformed funding approach, and this is this for us is comes from so many of you and was built with your contributions, your perspectives, certainly all of the knowledge and the experiences you've shared with us, whether that was through financial information or through some of the challenges that you faced, and actually being able to use your resources to support children and to support families in a way that mattered and that was relevant to them. And so what we worked with you to build was what we call the Measuring to Thrive framework. And that's a set of indicators that help to recognize that children and families and communities all have different points of departure and start from different places. And the intent behind that framework is to really take the conversation of child and family services and lifting it up to really a conversation about well-being. So child safety is critical, but that's not the only thing that we're talking about here. We're talking about addressing the root causes and recognizing the causes of contact with child and family services, with protection more specifically. So when we think about the Measuring to Thrive framework, these indicators cut across communities, families, and children. And so community indicators are meant to capture environmental and social and economic factors, things like potable water, broadband access, control of education, all of those sorts of things. When we think about the indicators associated to families, that's really whether families, caretakers, parents, aunties, uncles have what they need to be able to support children, to support their families, and also that they themselves feel supported if maybe things aren't always going as planned. And then when we think about the well-being indicators associated to children, this is where the majority of the indicators really are. And when we're trying to understand how children are doing, we're trying to understand it through multiple different perspectives, right? We're asking, how are kids doing spiritually and physically? Are they connecting with elders? Are they able to learn Indigenous languages? Are they safe? Are they able to go to school and learn? Are they meeting those basic physical and pedagogical targets? Are they able to create relationships like friendships? Do they have good relationships with siblings or parents or other members of their family? So when we take these three pieces together, we start to think about the well-being of children and families and communities in a holistic fashion. And for us, this set of indicators is such an important point of departure for the discussion on funding, but also critically for the discussion on long-term reform. Because this framework is meant to reset the entire conversation, the entire system in child and family services to one that's focused on well-being, not only one that's focused on safety. So we're really looking at promoting thriving, healthy, happy children and families and communities. Tracy, I think we're ready for the next slide.
Can I just add to that, Tracy?
Oh, of course. Pardon me.
Sorry, I just really wanted to make clear that when we did this work, we were at the NAC, and again, the National Advisory Committee for Child and Family Service Reform came from the work that we were doing and the orders from the CHRT. So the intent of the NAC, as we're calling it, is really to come together for that long-term reform, and we have representatives from all over Canada. So just to underscore that, when we did the work of the Measuring to Thrive, it was listening to frontline workers. It was getting all that information from across Canada to really understand what was well-being in our Indigenous communities. It was also really important to us when we first started this work. As you know, the Truth and Reconciliation calls to action 1 to 5 what were related to children. To the child welfare system. And of course, number 2 was to call upon the federal government to publish annual reports about where the children were at, and not necessarily how they were doing, but reasons for the apprehension. So it was important to us not only to know where they were, the numbers, but also how well they were doing. And that sort of spurred on the Measuring to Thrive. And of course, understanding that we needed to understand where our communities are at, where our children were at, and what did we need to have our children protected and be really loved in the warm embrace of their culture, clan, and community. And that's sort of where the genesis of Measuring to Thrive. So we needed to know how much it was going to cost to prevent our children going into care. That was one thing, but also what it was going to cost for them to thrive. And because, as you know, the archaic model, the funding model that we took Canada to court, the Directive 20-1, which led to the discrimination. We could have no part of that, and we had to come up with something better, which was the Measuring to Thrive framework. And of course, Cindy pushing the Spirit Bear plan. That's all of the, we always have to think about what is it, we have this time in history to make fundamental changes. And I think I'm just so happy that we're here at this point where we do have the Measuring to Thrive framework instead of an archaic discriminatory funding model to really look to.
Well, I guess I'll wade in here. I agree with everything that, of course, that Mary and Helaina have said. And I'll tell you a little bit about what I know about compensation. So the compensation, it's important to note, also arises from the Canadian Human Rights Tribunal proceedings initially, because the tribunal has the authority under the Canadian Human Rights Act to make an award damages to victims of the discrimination. An important thing I need to emphasize here is that the victims of the discrimination are the children and the families. It's not the organizations or the First Nations they belong to. That's not where the finding of discrimination rests. So that's why the compensation is directed at those victims. Now, it only goes back on the tribunal side to 2006 because that's all that the Canadian Human Rights Act will allow. But there were class actions filed on top of this. Now, the benefit of a Canadian Human Rights Tribunal award of $40,000 flat is that there's no investigation of your records that's needed, no speaking to children that's needed. But when you do a class action, you're going to be awarding people greater damages based on what they experience. And so they're now in the process of figuring out what those upwards adjustments would be. But the Class Action Council for the Assembly of First Nations and the Class Action Council for the Mushima Group have already agreed on this fixed amount of $20 billion. So it has to satisfy the tribunal's orders and then provide some kind of recognition and justice to the other family members and children included in this group. I should note that one of the tribunal's orders is about how the money gets flowed. And in that order, the Caring Society has been very clear that we will be looking for that many aspects of that order to be preserved, such as putting the children's money in trust, such as having mechanisms for high-risk young people so that they don't get $200,000 and they're in the throes of addiction, that to whatever degree we can safeguard against that, we do. That there's mental health, financial, and other supports available prior, during, and after the compensation is given. We don't know exactly what will be agreed to by Canada and by the class action folks, but we do know if there's ever an effort to amend the orders before the tribunal, the Caring Society gets a say. And all of this would have to be approved by the federal court. And people can come forward at the federal court and say they like this part of it, they don't like this part of it, or they, present another option. So it has to be certified by the federal court. It's unlikely that there will be any compensation flowing at least until the fall. That's what I can say about that. Next slide, please. So the next step of this is these are non-binding agreements. And so the idea would be to create a binding agreement if we can. The tribunal still has jurisdiction over Child and Family Services, Jordan's Principle, and reform of the government. So whatever we come up with, it would have to be approved by this panel. And I just want to say this panel has stuck this case out and have really become experts in all the different funding formulas in Jordan's Principle over the years, because they've been sitting on this case now for just about a decade. So they're going to have to approve any final order that says, okay, well, we've satisfied the tribunal's orders. The tribunal has to make a final order. The other thing is we need to implement and plan the rollout of this new funding and further develop the funding approach that Helaina is talking about in phase 3. That is going to be an issue where we need to calibrate the timing. As of April 1st, there's going to be immediate benefits rolled out, post-majority care, prevention at $2,500 per capita. Nobody's going to go down if you're receiving more than that, is the commitment by the government. But after that, we have to kind of just take a breath and then see how we do this next set of work in a good way because of what Mary's saying. This is our real shot at getting this right. And we have the research and we have all the people and the expertise in the communities to do it, but let's make sure we're giving it the time it needs to get done. I think that's it for the slide.
Okay, thank you, Cindy, Mary, and Helaina. We'll go to the questions now. We had a few questions about the agreement in principle on compensation, and then many more questions on the AIP on reform. So we'll start with the compensation. The first one is a two-part question. Can you confirm that compensation will be provided for children brought into care based on poverty between March 31st, 1997 and March 31st, 2022? In Manitoba, we don't have indicators of poverty available within the CFS data. How and what will be included in the definition of poverty?
Right. I can't, and I should just say this just as a general statement, I'm not sitting at that table. I don't know what they're agreed to. I can tell you what the tribunal's orders are. And the tribunal said that where children were unnecessarily removed, they're entitled to compensation. What did they mean by that? It wasn't that social workers had another choice. It was that the federal government had so desperately underfunded all of the services to keep families together that the social worker didn't have any tools to keep those families together. And that's really about neglect. So it's not going to be about talking about whether a child was poor or not. It'll be at the reason for which that child was placed into child welfare care. And if they were placed there for neglect, then they ought to be eligible for compensation. It is open to Class Action Council and Canada to agree on a different definition, but that's the floor. Those are the existing orders of the tribunal. They could be amended, but the parties would have to agree to amend them. And for me, what I'd need to see is a solution that's better than the current one. And I really don't want children to be spoken to. I think it'd be so traumatizing. We've all had family members who've been part of the IRS and the 60s scoop and how traumatic that is. So we're going to have to come up with a way that measures this on the basis of the available data, but safeguards these kids at the same time.
For children currently in care, will Child and Family Services agencies need to apply for compensation on behalf of children in care?
Yeah, they're working that out in terms of the process. There's a distribution thing where we're hoping that the department, because as all of you know, when you bring a child into care, you have to put in their IRS number, their registry number, status number. So the department will be able to identify many of these kids just on the basis of what it already knows, to be able to eliminate the burden on a First Nation agency. But there may be circumstances where they miss a kid, right? We know that the department's data, unfortunately, is not that great. And in those circumstances, there will be a place for you to be able to go forward and contact and say, hey, I think this child may be entitled to compensation. I'd like you to look at their circumstances. And the other thing I'm going to do, Tracy, is I'm going to put in the chat a website that folks can go to get more information about the class actions, or to even contact these lawyers and ask some of these very excellent questions that you're posing to them directly.
And we will include any of the resources that are posted in the chat. We will include those in the newsletter that goes out with all the links.
Great.
Is there anything in the compensation AIP for those families families who have lost a child while the child was in care?
Actually, we have even better than that. We have a legal order. What happened in remember March 13, 2020 is when the pandemic locked everything down in Ontario. It was about a month after that we were in litigation with Canada again. And over this precise issue. Canada did not want to compensate the estates of children who had died. So we felt that was completely unjust. And we litigated against Canada. And fortunately, the tribunal sided on the side of the children's. And so any child or parent who was eligible for compensation, had they been still alive, their estates will be eligible for compensation. So I think of young people like Tina Fontaine, for example, her estate will be eligible for compensation.
Is there going to be research on children that were in care and lost their lives once they reached the age of maturity?
I don't think that's being contemplated right now in terms of any kind of research agenda. This is a legal mechanism to distribute the compensation owed to these victims. It's a possibility that I've heard some discussion that maybe there will be some kind of trust established later on that could facilitate that kind of research. But at this point, I don't know of anything that's being anticipated.
And is the funding for this settlement coming from new monies, or is it current First Nations monies that are held in trust?
That I don't know the absolute answer for. It was a really good question. I know when I read it, I thought, I had not kind of gone out, that had not gone on my radar. So that's a question that we're going to have to ask them for sure. They have told us, however, that it's new money. So it's, and we have an order, just so everyone knows, there's actually another legal order we can rely on. It's called the reallocation order. Because what Canada was doing is, for example, to pay for more prevention services when they were ordered, they were taking the money from education or other programs, housing. Well, we didn't want that to happen because those programs are totally underfunded. So there actually is a legal order on the books that says that Canada cannot take from those other pots of money. It has to take from its general revenue. So I expect that's what's happening, but we will have to confirm and get back to you. It's a very good question.
And one more question about the compensation. If the child does not have status, will they be eligible for compensation if they were receiving services through provincial agency or provincial services?
Right. This compensation arises from the Canadian Human Rights Tribunal, which was the federal funding for Child and Family Services and the federal funding for Jordan's Principle. The key piece was that child served under that program or not? In most cases, children off reserve were not. And there is another class action for those children that is underway. It's in earlier stages, but I will put that in the chat. And people could follow that one along. But at this point, this is for children who are served under the federal system, both the class action and the Canadian Human Rights Tribunal decision.
Okay, we'll move on to the questions about the AIP on long-term reform. There are several questions on the $2,500 per capita in prevention. One that just came up in the chat is, where does that $2,500, where does that number come from?
Thank you for the question, Cindy. Mary, if it's okay, I'll take this one. Yep. I've included in the chat the details associated to that $2,500 amount per person. That amount comes from the practices of an existing FNCFS agency whose programs, whose activities were focused exclusively on prevention. And so there's a specific list of activities associated to that amount, and they cover the full life cycle. So that cradle to grave approach, associated to supporting families, children, that profile, the list of activities, the different areas of intervention are all included in what we call profile number 2, and it's in the phase 1 report. I've included the link in the chat and those associated page numbers. And so it's really important that we're clear that amount is not a range. That amount represents a very specific set of program activities.
Thank you, Helaina. Is April 1st, 2022 confirmed as the date that each band member or resident on reserve will be receiving $2,500? And if so, is that paid to the CFS agency or each band by Canada? And also, is that an automatic payment or do we have to apply for the payment?
All right, really good questions. I'll take a stab at these and I'll have Mary do cleanup on this. First of all, this is going to come as a result of a legal order again. So not as the agreement in principle, meaning it will be binding on the federal government. They will be required by a legal consent order that hopefully gets approved by the tribunal in the next couple of weeks or so to pay these funds. Now, remember when I said the discrimination the tribunal found was at the level of the children? Well, what's going to happen with this legal order is they're saying, we're going to give you another $2,500 per person in prevention, and we're going to fund post-majority, and we're going to fund band representative services. And in exchange for that, you will agree that the discrimination has lessened to a level where children as of April 1st to go into care no longer get compensation. So it's the child making the compromise, right? So as of April 1st, our lives got better. We're not experiencing the depths of the discrimination in the way we were on March 31st. Therefore, compensation is not owed to me. That's why it's very, very important that the money go to whoever is providing the prevention services now. There be no disruption in the prevention. And that opportunities be built to create more holistic programs of prevention in a community. Some of those may be by the existing service providers, some of them may be by additional service providers over time. But the key element is that there ought to be no disruption of the actual prevention services that are being provided. Mary, do you want to kind of build on that?
Yeah, I think it's really important to understand that, and again, I say this for BC, but there was all the work that has been done to date by agencies developing that capacity within their agencies. And so they have been doing that work. This is going to be in addition to that. I also think it's important to note that when we're looking at prevention, and if you read the AIP, I think we did a pretty good job as best as we could to really ensure that it was holistic in nature, and especially to include that cultural piece. So any of those cultural pieces, any of the holistic well-being of that child, and looking at it that they belong to a family, they belong to a community, is really reflected in that work. There's other pieces of that that's outside of prevention that will still be funded at actuals until later.
There are a number of questions about the scope of the per capita issue and whether the $2,500 per person, does that include off-reserve members?
It does not include off-reserve members. This is very important for those of you who are working in leadership positions. There should be some direct advocacy with the provinces. You'll all remember the days when on reserve was so severely underfunded. The provinces, as bad as the funding was, were often higher. But now, as we've dragged collectively the federal government up to a higher level of funding, some of these provinces have dropped back. So we really need to make sure that the provinces are funding equitably and that we don't wait too long. I think that this is we can build off the success of the Canadian Human Rights Tribunal to say to provinces that, look, you either step in line and do the right thing for our kids on and off reserve, or you could be facing a similar type of legal challenge and be held accountable. But we can't let the kids just lose out because of where they live anymore.
The AIP specifies that nations that draw down jurisdiction will not be covered by the agreement, but also states that, and this is a quote, they shall not receive less funding than they would have received under the reformed CFS funding approach for services for which they have assumed jurisdiction. What process would nations use to enforce that clause?
Oh my gosh, there's the $1 million question.
Mhm.
The act itself does not contain convincing language that would allow for enforcement. It simply says that the federal government may discuss funding with you. That's it. That's all they're obligated to do under the act. And we have said, as the Caring Society, that our view is that self-determining nations ought to be able to decide for themselves what level of funding would be sufficient. And they ought to be able to say that the structure of the funding and the amounts by the tribunal are their floor, and they can build up from that. Canada unilaterally has said, no, we're off the hook on the tribunal as soon as you sign on the dotted line. And trust us in reaching these funding arrangements with First Nations. Well, I don't trust them based on their track record. And I have just actually was on a call today to ask exactly that question of the feds. How are you bringing these funding agreements in line so that First Nations don't lose out? And they say they're working on something, but I have not seen it yet. So I would just recommend serious caution for any First Nation who's thinking going down this route, because that would mean you would not get the prevention money, the post-majority money, the money for capital, all of that. The federal government takes the position is off the table if you go down C-92. They say at the same time, it's on the table because we'll negotiate with you directly. That might be true, it might work out, but enforcing it's going to be very hard unless you have a very specific agreement. And some of the agreements we've seen so far actually include clauses that would immunize Canada from any legal suits coming forward for insufficiency of funding, which is very problematic from our point of view. We think that kind of language should not be included in any funding agreement, that Canada needs to not allow the discrimination to recur, and to really be true to its commitment, as it says it is, to self-determination. That means having the proper resources there. Mary, Helaina, anything else you want to add?
I think it's again, and thank you for that, Cindy. I know that this is there's changes that's been happening every week, and I really do appreciate Cindy being on the ball with all this work, and Helaina. But this piece is so important because think about the fight, and I will tell you this: at the negotiating table, there was going to be no backing down from the society. We fought too long and too hard to ensure that there was justice for children. Now, what we want to ensure moving forward, whether or not it's a C-92 agreement or what you want to do, is that the discrimination would be offloaded to the nations themselves, which is a very real possibility. We fought for that post majority, for capital at actuals, for the prevention at actuals, until such time as a funding formula was developed. And as you know, in C-92, as Cindy said, the act doesn't really doesn't even reference funding. And for sure, the piece that I think what's important is that even though you may negotiate something, it's not enforceable. So there is work to do. And again, I would say proceed with caution, because we also know from across Canada over the years that even when we did have this prevention at actuals, there were certain costs that were ineligible expenses, and across Canada that really, I would say, harmed children and families further. So we really have to look at what the history of Canada is. I mean, come on, we have 21, we've had 21 times having to go back to court. And just to say, okay, well, this whole new era where we're talking about what prevention is, to stand your ground, to say this is what our children and families need. We need to have capital costs at actuals. We need all of these things, but never to lose sight also that Canada has committed to the Truth and Reconciliation calls to action. And in that calls to action, when we talk about child welfare, is that you have to look at the services, programs, everything that you're going to be providing in relation to the impacts of residential school and overcoming that. So not only do you have to think about the past harms that has happened, what's going to get us to that place where, as one child said, that they will only read about the impacts of residential school, not have to live it every day. We want to get to that place, so we just have to be extra cautious moving forward. And we're going to be doing that, I think, again, by being united and ensuring that we're really reflecting exactly what our communities need. Because the other piece too, don't forget, and it's important to note that when Cindy's talking about, it's not only the levels of funding that we have to ensure is correct, but more importantly, it's the structure of the funding. So that is what the phase 3 work that the Institute of Fiscal Studies and Democracy are doing, Dr. Helaina Gaspard, along with us. We're making sure that the structure, so we can actually have a predictive model. So we're going to know, a few years down the road, what our communities and our families and our children are going to need, rather than depending on what Canada thinks that we need. So that structural piece is so important. Okay.
Can you speak to nations that are in the process of drawing down jurisdiction? So if they've started that process, maybe they've signaled their intention, they're registered on the website, before they actually complete that process, are they covered by the AIP and the CHRT orders?
Well, I would say they are until they sign a funding agreement. That hasn't, I haven't seen anything of writing from the feds yet that would confirm that to be true. I would just be very, very cautious, as Mary is saying. And what I can say humbly is, like, I've now been working this funding stuff for 25 years. And what I've learned is I would never sit at a table and negotiate funding with Canada by myself. That it really does take a multidisciplinary team of people who have got a lot of experience with funding to make sure that you've got the levels right, the structure right, and that you're anticipating different changes in circumstance. I even think about myself here in Algonquin territory. We didn't know those crazy truckers were coming our way. And then look, it disrupted everything, for children and families. It was very traumatizing for children and families. So, and there's natural disasters, there's all kinds of things that are going to happen, and that your funding could really turn out to be insufficient. And even on a more grassroots scale, sadly, because of the trauma of residential schools, our kids are actually have higher needs today than they were 20 years ago. And so if you have a very high needs child, that actually could exhaust your budget. And depending on how you structured that funding, you may not be able to go back to Canada and get more money. Or the structure of the funding may mean that you're depleting out of one area. So what Canada did before is they said, well, if you run out of money in prevention, go to your operations budget agencies. And that's the one that paid for salaries and the office and everything else. And so that's the way that's why structure is so important. So I would do a lot of caution, and I would invite Helaina to come and look at your numbers.
If I may, I think, Cindy, you're raising a really important point. Part of our role in this process is to make sure that there's information available, and that First Nations and that agencies have information, models, tools that they can use. And so whether you're looking to pursue jurisdiction, or whether you're an agency and you're looking at better understanding what reform might look like in your context, part of what we're here to do is to help stand up those tools, help stand up everything right down to budget making, to what implementation would look like, what that might look like for your particular context. And just to echo what both Cindy and Mary have said, if you are negotiating an agreement under the Act, it's really important, I think, to press that question to ISC as to how you would maintain that equity, at the very least, between those two tracks, between the program, the FNCFS program track, and the C92 track. There are some times that we understand that those options are meant to be similar, but it's really, really important to ensure that you press upon that, and that maybe you have comparisons and that you have models in hand to make sure that that information is tabled, and that, as Cindy and Mary have explained or expressed, that you're ensuring that your structure helps to change and helps make sure that your funding, that your resources change as the needs in your community change.
The other thing I just add is keep your eye on Jordan's principle, because the feds have said, well, Jordan's principle will continue, but if it's already covered in your child and family service funding agreement under C92, we're not paying twice. So if you use a broad category like prevention in your C92 funding agreement, and something comes up under Jordan's principle, like I'm just trying to think about respite for a child who has high special needs or medical needs or something like that. They might say, it's already covered off in your prevention budget, and you may not have anticipated that. So be very aware of what's happening on Jordan's principle as well, because that has had a lot of benefits for children and families. We want to make sure that that remains available.
We had someone suggest a kind of tricky way to get around the exclusion of nations that have drawn down jurisdiction. They wondered if they included a clause in their law specifically stating that the CHRT decisions are recognized and expected to be implemented. Would that supersede any attempts at the federal level to exclude them from those orders and the AIP, I guess?
Well, I'm not a lawyer, but that would be my first port of call too. I think that's an excellent idea, but I would double check it with a good lawyer. And by the way, one who's experienced in child and family and that kind of negotiation. And if they need to reach out to, our counsel to kind of get some information, they can do that too. They're usually really good. David and Sarah and Ann, they're an amazing team, and they're really happy to support. And then Mary knows of some great lawyers too, who have got some experience in this area. So I just be careful, go to those people who didn't just discover child welfare overnight. I guess is my best advice on lawyers.
For sure. And I think it's worth mentioning too, how those laws are operationalized makes such a difference in terms of implementation. So writing something down and having it in law is one thing, but the way that that's expressed, the way it's connected to funding, the way it's connected to structure, the way it's actually implemented has a massive effect, and certainly big implications for that negotiating process. So just to make sure that all of those pieces are kept whole, and that all of those big pieces of the puzzle, that you work on them in tandem when you're developing legislation, when you're associating funding, and you're determining how you're going to build out your performance or your assessment or your own evaluation, a piece of your delivery.
And what Helaina is saying, very important. I'd actually do scenario planning with the lawyers to see, it just is presumed that Canada won't implement that section, and then how you're going to litigate it. And really play that out, because there are different strategies for holding them accountable. But you want to make sure, like one of the things I've learned, you cannot litigate against Canada on amounts. You can litigate against Canada on structure. That's where Helaina's outcomes are so important. If you get Canada to agree, our kids are going to be here, and these are the indicators of which we're going to get here, and then Canada only funds you to a level where your children are here, you can litigate to get them up here. But you can't say, well, Canada's only giving us $80 when we need is $100. That's a much harder case to do.
We have one of the audience members that wants to ask a question. Victoria, do you want to?
Yes, thank you. Tracy Levin. Let me introduce myself first. I am a member of Wipluhan of the Gitniao, and I a Gitsan. I traditionally Gitniao, and I live in Gitskupla. I hear what the panel is saying with regards to structure, and I think that's really important, especially when it is the panel here that know exactly what was negotiated. I believe that the people that have been involved since day one with regards to taking the federal government to task with regards to children and being able to obtain a few $1 billion. I believe that we need to capture the communities, First Nations communities, First Nations from a traditional perspective, need to capture the vision of the people that have gone forward before the federal government and the courts to be able to move this far in terms of children and the protection of children. I hear what you're saying with regards to us having to ensure that, you know, that we take this process and ensure that we know exactly what it is that we're doing. But in order for us to know exactly what we're doing, we need to know what the vision is. We know what our traditional laws are pertaining to children. And we know the work that we have been doing with regards to child protection, residential schools, the children that have been found in unmarked graves. These are all interconnected. Now, how do we move these envelopes forward? Because they've caused social issues to our people over the decades. Now, my question is, how can this panel move this envelope forward that will capture all of it? One of the things that I've said at one of the meetings that we've had with BCAFN is it's not enough just to ask the Pope to come to the country. It's not enough for us to acknowledge the day and wear orange t-shirts. This whole thing with regards to unmarked graves is huge. It goes far back, you know, to the late 1800s. I've heard stories about people that were writing with their right hand and left hand, and I've heard that their arms were broken so that they wouldn't write with their left hand. These stories are horrendous. And our people still live with this trauma right to this day. Our children are still being apprehended as a result of the residential schools and all of the problems that we have, social issues, because of the residential schools. When I worked in the children's home part-time while I was going to high school, we received children that were disabled. Some were born with no hands, some were born with cleft palates, some were born with not being able to see. Disabilities. Some were taken in because of neglect. These are the questions that you brought forward. These are the issues that I'm sure that you brought forward to the federal government and to the courts, saying that this is the experience that our people have had since residential schools because of its impact. Right to this day, we still put up with or contend with sex offenders, child sexual abuse, domestic violence. All of the issues, social issues, still exist right to today because of the residential schools. Our life skills have depleted. Our parents today do not know how to raise children. So there's a lot lacking. So I would like to see this panel continue working and together in ensuring that the vision that was brought forward to the federal government is implemented at the community level. If it means requesting for plans that capture every item identified in C92. So these are really important. And there's so many children that have been in care. My son was named after a child that died after he came of age. He was in the system meaning the ministry. His parents died from overdoses, and they were living in Vancouver at the time. You know, they were into cocaine. So basically, what I'm saying is I really want this panel to continue playing the lead part of this whole process so that we do not lose the vision over time, and to ensure that your visions are captured in everything that we do, because I like what you said about your approach, and that's cradle to the grave. Thank you.
I think, thank you, Victoria. And I think really when you looked at the, again, the genesis of the work and to understand, it was really important at the NAC level, the work that Helaina did, you know, and Cindy, like all these years and all the ones that came before, that was reflected in the work that we did. So that's why we have that measuring to thrive. That's why we're trying to say self-determining nations. One of the things we always know, I always say this, we've always had the inherent jurisdiction to take care of our children. What we haven't had are the resources to breathe life into our own laws. And now that we have this opportunity, we got to make sure that we are exactly. You know, we call it the life cycle approach, but don't forget also that there is work that the nations need to do. We understand that. There's no rush for anybody to sign an agreement tomorrow or the next day. It's just like this, like when we did the, you know, back in 2007, when we went to court, I remember thinking, oh, we're going to be done in 2 years. You know, it was not till 10 years later. Like, and every year I thought, okay, this is the year. But in that time, like we made sure that we tried as best we could that every injustice that was done, that we considered that as best as to our ability. So now moving forward, there are still actual costs, like the operational piece, you know, data is now covered. Nations need to find out how well their communities are doing now. You know, that's a big body of work, set their baseline. How well are your children and families, so that you know in 5 years that there has been an increase in well-being and that your communities are thriving more so that we could overcome the impacts of residential school. How are leaders going to know what we're fighting for? And that's why, again, the structure of the payments it's not the amount, it's the structure, so that we can, it could be easily amendable. So we know, okay, you know, this year the needs have increased, then you're able to, your funding can flow with that. The population has increased, all of these pieces. So as much as we could, it does reflect that in the AIP. And I think that vision of the nation, that is what's going to carry you. Our vision, are always having those principles, and when your laws will be based on our principles. Much like, for example, Canada Health Act, the principle of every Canadian has a right to health care. You know, we're going to have principles like that. Every child has a right to live in a world free of the impacts of residential school. Principles, things like that. So I think it's really a good points that you made, Victoria. Thank you.
And check out the Spirit Bear plan. I'm going to put the link in the thing. So to end all the inequalities in water, education, early childhood, this case, I think, should be an inspiration to really address all those other areas. We can do it. And we've shown ourselves that we can do this for our kids. So let's do it for these other pieces too.
We are getting some questions from the audience. We're just going to move through a few more of the pre-submitted questions before we open the floor up to more questions. This one's about the source of the funding. So it says, pursuant to paragraphs 9 and 13 of the AIP, if a First Nations agency has entered into a coordination agreement or will be entering into one, will that funding be dispersed from the 19.8 billion to fund the First Nations agency's legislation?
The answer to that is no. There is that 19.8 billion is for the program, and the feds have defined the program as being, you know, the constellation of First Nations and First Nations agencies working under provincial delegation. I don't agree with that approach. I have told them that. Many people on this screen have told them that, but it's going to take some serious political advocacy to get them to move on that particular point.
There's some questions about capital. This one is, we're interested in resources for capital costs for on-reserve prevention services, For example, we have no dedicated group meeting spaces in the community for parenting education, sharing circles, counseling, or other prevention work. All of our current infrastructure was funded and designed solely for child protection services. We have to function in tandem with existing child protection services, so we can't be expected to keep sharing and borrowing their spaces. Are there any funds available in 2022 and going forward?
Another order. I love the orders because they're enforceable. So you all remember on September 29th, there was the 2 decisions issued by Justice Fable, who's a First Nations judge out of Saskatchewan. So shout out to Saskatchewan. In the federal court. And really what that did is it cemented the capital order. So Canada has to fund at actual cost the capital related to the provision of child and family services. So that is wonderful news, and it's the full cost. So it could be things like you're talking about spaces to bring parents together. It can be things like youth centers. It can be things like if you're wanting to do land-based interventions and needed capital for that. So there is a capital order on the books. It also covers Jordan's Principle, the provision of Jordan's Principle. So if you needed space for your navigators, you can also apply for that to be covered under that actuals order. What it does not include is spaces for off-reserve service delivery, unless you locate an office off reserve and you say, for example, like many of our communities, there's a housing crisis, there is no space on reserve, or it's better, it's more accessible for the children from multiple communities to meet in place X off reserve than on reserve. Under those conditions, you can also get the funding of capital for full cost for child and family services and Jordan's Principle. I don't know, Helaina, Mary, if I missed anything.
Absolutely, Cindy, pardon me, on the orders, which is really exciting. I think just to note too, part of what we're going to do in phase 3 with a number of collaborators is actually start to identify those spaces, identify what they might look like, and then also to try to put some numbers around them. So we appreciate that it's not coming, right away in the next couple of months, but certainly information that we're hoping but that we will be generating in the context of phase 3, and that we hope will be useful for a number of agencies and First Nations.
Thanks, Helaina. I think that's really important to know is that there's further work going on the capital needs assessment. So what nations can already start doing and agencies, I know we did this over the last few years, is actually start acquiring your capital needs in your community. I also think it's important to note that when you're looking at the capital order for the at actual cost, that not to forget the Jordan's Principle. I do know, Cindy, that what we also had talked about is if the service was not couldn't be on a reserve, but it was going to benefit many nations around that reserve, then that would be a cost that would be off reserve. So for example, there are certain Jordan's Principle services that are required, but there's no space provided, that it could be possibly built in a central location so that many nations could access that.
That's right. That's an important clarification. And the other piece is for off reserve, you can apply to do a feasibility study and get that funded by the feds for Jordan's Principle off reserve. So we say if you have a bunch of kids in Vancouver and you're from a nation on the island, you could say we want to do a feasibility study about the provision of Jordan's Principle off reserve. Now, whether they'll do it or not, that's still unclear, but it's definitely in the agreement in principle and it's in the legal order as well.
There's a question about housing. So there's a reference in the AIP to $2 billion for housing in First Nations communities. Is that from the 19.8 billion, or is that a separate pool of funding?
No, that's inside that $19.08 billion, and it's really meant for those families. And we all know about them. They're in a housing crisis. There is no place for them to go, or they have a child with special needs, and there needs to be some kind of renovation so that child doesn't have to be placed in alternative care, but can remain in their homes. So it's really tied to kind of really supporting families who are in those critical housing situations so that they can stay together.
I'll just give a couple of examples, Cindy, from what I've heard. So for example, there was a young father, the mother is out of the picture. And so he came back, we provided as wraparound services for him, but there's no house in his community. So we went closer to the municipality. There's no house there. There's no rentals. There's nothing. So being put up in a kitchenette at a hotel. So there's things like that that happens across Canada. We've heard that. So in that case, of course, there would be housing. There's also a story where grandmother was able to take her 3 children back, 3 grandchildren, but lived in a 1-bedroom apartment and moved back to her home community. There's no homes at all for her. So then the community built a little home for her 3 grandchildren. So I think there's those types of cases. I know I've been asked a lot of questions like that, but for sure those would be an actual cost because you're keeping a family together and out of care.
Is there funding to support the gathering and analyzing of data in terms of needs assessments?
There is needs assessments for First Nations without agencies on the capital piece, and that's $25,000 per First Nation. I have kind of lost touch with how that's going. I mean, one of our concerns is needs assessments can be helpful to the nation, but sometimes when you're trying to use them to develop policy, if they're done in all different ways, then you can't really look across them and draw any real lessons from them. So Helaina, do you have anything more on that needs assessment funding that you could?
So on the needs assessment funding specifically, Cindy, you certainly would know more than I would. To say, however, to Cindy's point on that aggregate perspective, if we can call it that, to help develop policy, that's something that we're working on right now. We're going to be reaching out to First Nations who are not served currently by agencies to try to work with them and to understand where their communities are at right now. What is that baseline? What's your point of departure? And then also asking them too, what services they're offering now, what they would like to offer, and where those gaps are. And so part of our role will be putting a cost on that gap between the current state and the future state, then of course to identifying what those activities are that First Nations are seeking to deliver for their communities.
How will the issue of mental health services for Indigenous families, children, and youth be addressed? Funding is one thing, but we face extreme barriers in terms of wait times and culturally inappropriate service delivery within mainstream services.
So to the extent that, mental health is kind of linked to CFS and Jordan's principle, we're able to kind of address it in this framework. And we know that multi-generational trauma is a real issue. And that, of course, underpins all the addictions. So you could, for example, develop your own mental health treatment center in your community for community wellness and build that in, build the capital in under CFS if the goal is to kind of keep families together and address that multi-generational trauma. Or you could do it under Jordan's principle and say we have a group of young people here who need that kind of intervention. And so we're going to provide mental health services under Jordan's principle. Now, all of this assumes that you have people in the community or accessible to your community who you trust to provide those services, and that's not always the case. And that's another reason why the work Helaina is doing in phase 3 is really important, because it's about how do we build up systems so that those services and those people are in place. And particularly in rural and remote areas where you're not dealing with the constant rotation of new faces coming through. They come up from the south for a couple of years, they do their stint, then they go down. And there are some great models across the country on how to address that, but that's the kind of stuff we want to take a deep dive in this phase 3 and figure out how do we support communities to be able to do that. So I hope that helps. And that's where the Spirit Bear plan comes in too, is remedying all the inequalities across everything, including mental health.
Yeah, there's another similar question about capacity building. So the shift in funding to address structural issues also requires a retraining of staff to promote a mental shift in how services are offered. I think there's a strong culture of intervention in agencies that are used to being limited in how they can offer prevention services. So is there any space in this to address how staff will need to be trained to do the work?
Yes, I think you can use that prevention money for that kind of training. Absolutely. And what I find is when we are big proponents of the Touchstones of Hope model. And the reason we're proponents of that is because it's difficult when people say, oh, well, we're going to do something self-determining. It's hard to put meat on the bones on that. You know some of the elements, but what you want to do is bring the whole community together to vision what a healthy child and family is for them. And then where you are now and how you're going to get there. When everybody has that shared vision, it gives them an alternative that is better than what they have in their minds right now. And people then find new and creative ways of moving towards that vision. So the Touchstones of Hope is something that has been used by many First Nations across Canada. And actually that whole visioning process can involve children, elders, everybody in the community can have their say. So everyone really shares in the vision. And from that vision, that's where your laws will draw down. And that's something I just want to put as another caution for C92. Because humbly, I've never seen a First Nations child welfare law. I've seen children's laws and clan laws and familyless laws, but they're much more holistic. And all the feds are prepared to fund you under C92 is strict child welfare. And so you just got to, you know, and that might be an okay thing for your community, but you just need to be aware of that going in there.
We'll take another question from the audience. Kirby Minifigures, do you want to ask a question?
Mute.
I think you're still on mute there, Kirby.
Yeah, I'm trying to get off. Oh, there we go. Oh, okay. Thanks, guys. Oh no, excellent presentation. You've given me answered a few of my questions. You know, the news about capital prevention support, that's all great news. Something that wasn't available before. But my question, I kind of brought it up at the last webinar, is you know, we in 2011. I'm with the Blood Tribe or Kainai Children's Services, and we negotiated a sectoral self-government agreement. Unfortunately, didn't get back by the community. Our vote failed for a number of reasons, and primarily because, you know, we had to contend with the inherent right policy, you know, with the whole negotiation. So it had a number of pitfalls which we couldn't get around. However, at the time, one of the things that we were negotiating is, you know, like I said, this is all good news when it comes to resources for prevention support. However, in our case, you know, we were attempting to negotiate a scope of jurisdiction that was similar to the province. So, you know, there's prevention support, again, that's great. However, you know, I think our view is a little bit broader. You know, I think, you know, recently, you know, as a result of the sectoral process, we were able to build a number of prevention support programs in our agency, and that was good. Our numbers reflected that. However, for some inexplicable reason, we were hit head on by the whole opiates crisis. And that sort of changed everything for us. You know, our numbers were no longer low. You know, that's kind of a new reality for us. So within our scope of jurisdiction, you know, we were looking at, you know, putting in place, you know, some drug endangerment laws that relates to children. You know, they have that in the province, Alberta here. There's also some laws around human trafficking, you know, with youngsters. And disabilities. So these are our three laws that we're looking in enacting, in addition to what we're calling our family preservation code. However, you know, the trick is, and this is kind of more, the question's more for Helaina, because it's a funding issue. Because you know, we're taking a more comprehensive and holistic and broader approach to child welfare, where we're going to include these things which they may look at as being periphery, but they're not for us. You know, they're very much a very sad part of our reality. So I was just wondering what the discussion is on that sort of funding, because you know, I'd hate to put a law in place and then find out it's not sustainable, or that we take on an obligation that we can't meet. So anyways, how broad can we interpret this funding, and how much flexibility, just with the work you've done so far? I know it's kind of a loaded question, but anyways, that's kind of been our experience so far, and that's what we're cautiously trying to step into. So, okay, thanks, guys.
Kirby, thank you for the question. I think it's a good one, because I can certainly speak to the approach that's intended for the reform, or the long-term reform of the Child and Family Services program specifically. Part of the important element of that approach is to ensure, Kirby, that it's read holistically. And that to us means that you can't pull the approach apart, because all of the pieces of the approach are meant to be read all together. So things like prevention and supplements for poverty, and the baseline funding, and funding for technology and capital maintenance, all of those pieces are all meant to be considered as one, you know, budget, or one holistic approach, so that service providers, whether that's an agency or a First Nation, has what they need to serve their community. And with, of course, what we would call emergency funding parameters that would be activated, or that are in place when happenings, when needs outstrip that, say, standard budget, or that more typical budget. The question you're asking, Kirby, about aligning your law to what ISC would be willing, or what ISC would be, you know, ready to fund in the context of jurisdiction, I think is such an important question. And I think it's an important question to put directly to them, because certainly in the context of the long-term reform of the FNCFS program, there is a holistic approach, and that's the approach that we've been talking about here, right? And I think it helps to address, at least in part, some of the big challenges that you're pointing to, and certainly, you know, no single funding approach, no single, you know, funding of one policy or of one program area will ever help to correct, you know, all of the challenges inside of a community. But it's certainly important that, you know, Child and Family Services has the flexibility and the resources to do, I think, as you're saying, which is starting to address the root causes of those challenges of contact with the Child and Family Services system. I hope that's somewhat helpful.
Okay, thank you.
Can I can also add to that, you know, because, you know, we've been working and drafting our laws now for quite a few years, like, or the foundational work. And we definitely know that, Kirby, like you, there's all of these different issues that prevent children to take care of their children. We know those issues around addiction. We know the addiction, what you're talking about, the, you know, the human trafficking, all of these things. We know, we heard from one of our colleagues, and definitely we've been hearing this, that you could put whatever you want in your law, but Canada does not necessarily have to fund it. C92 won't, like, you won't get the funding through Child and Family Services. So you're right, you have to be cautious as to, you know, you said that you don't want to put in a law that is not going to be sustainable, or that won't be funded. So it's really, we're grappling with that as well right now. And definitely what we're planning on doing is actually to have a legal think tank with some of the greatest minds to come together and say, how do we address these other laws that should be in our holistic law? Canada law does not reflect that holistic ways of being. You know, there's the Youth Justice Act, for example, that is separate than federal enabling legislation. There's different laws that are separate outside. And so right now, from what we've heard just recently, and Cindy, you can correct me if I'm wrong, but definitely that was sort of the sentiment. Put it in your laws, but we don't necessarily have to fund it.
Yeah, that's absolutely the case. And I know that we have some groups out there that are trying to push those boundaries, like Pegwis and others. So get a hold of those colleagues and see how things are going for them.
There are a couple of questions about community input into reforms. So one question about how can the regions have input into the new terms and conditions, given the fast pace that we're moving at? And another question about how parents and youth can contribute to the ongoing national child welfare redesign.
Yeah, I know this terms and conditions question must have come from my buddy Raymond, because we were on a call about it earlier. So the terms and conditions are really the roadmap on which the federal government can fund. And one of the problems has been is that they have really used them in a manner, and too often, that would really restrict practice on the grassroots level, right? Saying, well, that's not prevention. That should be covered by your NADAP program, or that should be covered by whatever. So there's a couple of stages for the terms and conditions. One is they need to be modified to be able to distribute that prevention money, et cetera, as of April 1st. We have until the end of this week as a subgroup to kind of get input into that. And if you can go through your NAC representative to get a copy of the terms and conditions and have feedback into that. But those are only going to be in place for a short period of time. So they're kind of a Band-Aid just to roll out the post majority and the rest of it. Then there's going to be a more serious go at this thing. And my view of this is that this is one of the things we should take our time at. We have the good research we've collectively done in phase 2 and all the feedback we've gotten from communities. We can do some foundational adjustments, but when the research is completed, when you've had a chance to see how it would look like in your community, that's when we need to tailor the terms and conditions so it really supports that grassroots practice. That's my own view. Helaina, you are a guru of terms and conditions as well. So I just wanted to see what you think. And in terms of getting time, I think we need to press for the time needed to get the program right, so that then we can write the terms and conditions right. I think the problem is right now we're being asked to write terms and conditions when we haven't even really flushed out what the reform project.
Cindy, I think you've said it really well, the importance between interim measures and interim terms and conditions versus those that would be the longer term terms and conditions. And certainly what we've understood from ISC to date is that in the long term, the terms and conditions have to be principles based, because the entire intent behind this approach is to move away from a prescriptive way of delivering services. And so terms and conditions have to reflect that. And that means focusing on principles, the best interests of the child, the well-being of children and families and communities, and so on and so forth. And so emphasizing those principles will be absolutely critical. But Cindy, to your previous point, it's difficult to move quickly when the entire program itself has not been reformed. So I think there's an important caution there about an interim step versus the long-term perspective.
Thanks. And thanks, Lynn. I just wanted to add to that. I think the importance and one of the conversations to ensure and people understand that, you need the terms and conditions in order to influence the funding that's going to flow from Treasury Board. But the importance of having that flexibility within the terms and conditions, so it's not prescriptive. I think that, well, I know that's exactly what had sort of impacted us over the years with our funding. It was very prescriptive. You also have so many different funding service officers, and so some funding service officer back east in the Maritimes will say no to this funding, but a funding service officer in Saskatchewan may agree to it. So when Helaina and Cindy talk about that systems reform, that's part of the work we're doing as well. We got to reform the system so that individuals themselves don't have the power to make decisions based on their discriminatory thought process or their biases. How do we do that? There's a lot of, I know Cindy's doing this wonderful work with the mind control people. I read that, Cindy. I love that work. But there's a lot of things that needs to happen when it comes to terms and conditions. And I definitely believe it's got to be principles focused, but also has to be flexible enough and has to be grounded in that measuring to thrive work that we're doing. I do know that I think that's where we need to be at. And so the time, again, and I've heard this again, and I got, people feel that it's very, very rushed. I keep saying, yes, April 1, there's going to be some funding, but don't think we have fought this long to get to this place that we're going to compromise anything, that we still have the time to do that, especially when it comes to the terms and conditions.
Just one more quick question. And this is about reconnecting children with their families. There's a need to connect children in care to their families. Are there any plans or resources or anything in place for genealogy tracing or ancestry tracing or anything like that?
Well, you could definitely use your post-majority funding at actual cost. Keep in mind, those are young people from the provincial age of majority up until age 25 to do some of that work. And this new prevention funding ought to be about kind of strengthening some of those family and kinship ties and clan law and clan ties. So I think that would fit squarely within the prevention money, if that's what you choose to do. I don't know, Mary, if you have a contribution.
No, I think right now within your prevention and within your practice at the agencies that you should have, you would have a worker, a genealogy worker that can do that anyways, or if not, then you should hire somebody that can, connections worker, roots worker, or anything like that. That's what they're usually titled, but for sure there is funding for that. Cindy, I just wanted to be clear, and again, I got a text. Again, the question around the federal sort of directive around the post-majority at being linked to a placement. Was there any news update on that?
That is thankfully gone, thanks to the NAC.
Yeah.
So a part of this is educating sometimes people in the department who have not done this work. So yeah, no, you don't require the young person does not need to be in a placement. They may be in a placement, maybe they were with their COCUM or whatever before, and they're just continuing on. That might be something, but it's not a placement dependent anymore, thankfully.
We're just about out of time. Cindy, Mary, Helaina, do you want to offer any final words before we close out?
I would just say that I find these really, really, really helpful to me. And I'm hoping we can have more forums as we go ahead, because this really helps us make better decisions when we're around that table and to be connected with what the real issues are. I want to thank you most sincerely for doing that. For those of you who are able, I really recommend that you participate in this phase 3 research. We want to develop a funding approach that's driven from the bottom up, as Victoria is saying, and towards the vision that the communities have. And a great thing about these outcomes is that you can actually develop your own outcome. Like maybe you have for your community, you could use those as your outcomes and then pick some of these other ones. So there's all kinds of ways of really driving the money towards your vision. But we need your support to really take this across the finish line. So if you're able to participate, I just really encourage you to do so. And Helaina will put her contact details in the chat. I'll volunteer her and see if she's willing to do that. Already getting some people who want to participate.
Yes, I was just going to say thank you, Cindy. Happily doing that right now. And just to echo Cindy, this work, not only do you make it possible, you're actually what makes it relevant and reliable and realistic. And that's part of the reason why we were able to get to this point, is because of you, right? We're just here to help put pieces together. We're here to help with the financial language. What you help us understand by talking to us, by inviting us to your agencies, to your First Nations, is absolutely and just unparalleled. We cannot say enough. You help us get up a learning curve. You help us identify the issues. And so we're always really, really humbled. I'm certainly very humbled when you reach out. And so we hope that you will continue to reach out, and please don't be shy to do that. We're really here for this. And it has been made abundantly clear to all of us here that this is our absolute priority.
Thanks everybody for being here, and it is really helpful for us as well. So when we're back at the NAC table, you know, all of these questions and things that we may not have considered come forward. I really appreciate this opportunity, but I'm so honored just to be on the same panel as Cindy and Helaina. What an honor. Thank you for allowing me to be here with you. I just wanted to say that the work that we do, it's all of us. You're all here for a reason. Everybody that's on this call, You're all here for a reason. And you think about how many people were on the last call, how many people across the country that are there. You give us strength. You give us strength that all the work that we're doing are for our children and families. And so with that, I just wanted to reiterate what I said earlier, when this one little 12-year-old child had said what his dream, what his vision was, is he dreamt of a day when he only had to read about the impacts of residential school, not have to live it. And it's incumbent on all of us to do that. So thank you so much for making this day possible. Masai.
Thank you, Mary and Helaina and Cindy. Before we shut down, we'll have Michelle close us out in a good way.
Creator, grandmothers, grandfathers, thank you for having us here today to join together to listen to the words of our dear panel. Again, we are so strong when we're together. May we continue this wonderful fight. Thank you, all my relations. Thank you. I forgot to say the video will be up at any time. Give us an hour or an hour and a half. It'll be up on our website, ourchildrenourway.ca.
Thank you very much. Michelle, I'm just wondering, would it be helpful if I sent over my email address for anyone interested, specifically interested? I was trying to note the emails from the chat.
No problems. And let me compile those for you, including the ones from the chat, just so you've got it all. I'll put it in a quick spreadsheet.
Oh, you're too kind.
No, I'd
Oh,
love to. Thank you for
thank
all of the
you.
work you do. Wow.
No, not at all. We're just here helping to play cleanup to Cindy and Mary. So it's no problem
Yeah.
at all.
Yeah.
I'm happy to do it. We can. Hi, Bart. Thank you again, Tracy and Bart and Michelle. We appreciate it. This is really helpful.
Thank you.
Okay, take care.
That was great, Tracy. I have to tell you, that really was a good session.
Yeah, I think that went well.